and going live. Hello and thank you for joining us this evening for our BVNA webinar on making first steps into veterinary nursing, the essential role of the veterinary care assistant. My name is Lacey Pitcher and I'm an RVN and a BVNA council member, and I'll be chairing this webinar this evening. It just takes a moment for everyone to join, so we'll give a few seconds and then we'll get everyone started. Okay. Before I introduce this evening's speaker, just some quick housekeeping. There should be a toolbar at the bottom of the screen. Please take a moment to just familiarise yourself with everything. If you have any questions, pop them in the chat for us, as this is a very popular subject this evening and we want everyone to feel included, and we'll endeavour to get through your questions as we go, as we're on Facebook and in the Zoom. Understandably, as veterinary medicine sometimes does, we are aware that some people might not make the webinar live this evening, but it is being recorded and it will be sent out as well. So if there are any questions along the way, do let us know and we can get them back to you as well. I'm now very pleased to introduce to you our speaker for this evening, Emma Foreman. Emma has been working in the veterinary industry since 1999 and qualified as a veterinary nurse in 2002. She enjoys all aspects of the role, particularly anaesthesia, theatre practice and ECC. Emma currently works as a first opinion and referral hospital part-time as a lead referral surgery nurse. And she joined the BVNA in October 2022. She thoroughly enjoys the role and enjoys working with like-minded people and promoting and supporting veterinary nurses and the veterinary nursing profession. And I am honoured to stand on council beside Emma. She will be covering the subject this evening with a wealth of experience and has a level 3 in veterinary nursing as a tutor for bottle green training in Derbyshire, and loves sharing her knowledge and experience with the next generation of veterinary nurses. So without further ado, I'll hand over to you for this evening, Emma, and I will disappear to the chat section to try and filter any questions we have, and we will have questions and answers at the end of this webinar.
Hi everybody, thank you very much Lacey for that lovely introduction, and thank you to so many people to join us this evening. Okay, I thought we were having tech issues already. So what we're going to be discussing tonight is the role of the veterinary care assistant and the learning outcomes. We're going to look at the practice structure and dynamics, what veterinary care assistants can do in practice, but also what they should be doing in practice. Opportunities for career progression, so from the VCA role, where can this lead to? And how BVNA can support VCAs in their career journey. So Lacey's pretty much covered this slide for me already with my introduction. So I qualified as a registered veterinary nurse in 2002. I'm a current BVNA council member. I have 2 part-time jobs, so one of which is I'm a lead referral surgery nurse in a small animal practice in Stoke-on-Trent, and I am a level 3 veterinary nurse tutor. And I'm also a clinical coach, and I'll explain a little bit more about what that entails later. So there's lots of different names that can be given to veterinary care assistants. So they can be known as VCAs, PCAs, so patient care assistants, ACAs or ACAs, animal care assistants, and ANA, animal nursing assistants. They're all the same role. And for the purpose of tonight's webinar, we'll be referring to the role as VCA. So having a look at the typical team structure in a veterinary practice, we usually have either a principal veterinary surgeon or a clinical director who leads the practice or hospital. practice manager, a client care team, who often either call client care or receptionists, the same role. We have veterinary surgeons, registered veterinary nurses, or RVNs for short, student veterinary nurses, so SVNs, our veterinary care assistants, or VCAs. And we also have vet students who spend time in practice to gain experience, work experience students, and then also the housekeeping team, so cleaners, maintenance, to keep everything ticking over for us as well. So looking a little bit closer at these roles, so principal or clinical director and practice manager make up the senior management team. Sometimes RVNs can be a part of this team as well, but these are the people who are involved in the management of the business. They deal with recruitment, any disciplinaries or appraisals or one-to-ones, the practice finances, and if there are any complaints that are made. So veterinary surgeons, their role is quite vast, but it's sort of a few of the things that they do. They do consultations, so they see people who bring in their pets for appointments. They perform diagnostic imaging, so this includes things like x-rays, ultrasound scans, CT scans, medicine, surgery. It's obviously a client-facing role, so these are the people who are talking to our clients, who do decision making. They can diagnose conditions or illnesses. They are able to delegate some tasks to other members of staff, which we'll cover in more detail later. And to be able to do this job, they need to be registered with the Royal College of Veterinary Surgeons to be able to practice in the UK. Our registered veterinary nurses, so this is pretty much a nursing role, caring for the patients, but this role can be quite diverse and can lead to lots of different areas. So we can have a head veterinary nurse who is in charge of a team of veterinary nurses. In bigger practices and hospitals, we can have lead nurses who are in charge of a team in a specific area. So maybe a lead medicine nurse or a lead surgery nurse, or be like a lead of a group of consulting nurses, so other disciplines as well. They can progress to become practice managers. They can choose to work in specific disciplines, particularly in larger hospitals. So they might choose to work as ward nurses, where they look after the patients who have been hospitalised and are staying in for treatments. Or they may be a theatre nurse, so they work with the patients who are having operations. So there's lots of opportunities. And they can perform Schedule 3 procedures, which are delegated to them from the veterinary surgeon. And I'll explain more about this a little bit later. And as well as the veterinary surgeon has been registered with the RCVS, veterinary nurses must be as well. Then we have student veterinary nurses. So to be on the student veterinary nurse course, they must also register with the Royal College of Veterinary Surgeons. They can perform the same roles as an RVN, including the Schedule 3 procedures, but this has to be under direction or supervision from a veterinary surgeon. They are assigned a clinical coach. So this is somebody who helps to work with them with their practical tasks. They'll be attending college or university to learn the theory side, but in practice, in their work, they'll have somebody who teaches them the practical tasks that they need to do. So it could be, for instance, radiography, and they have a portfolio where they log the evidence of the tasks that they're completing. So depending on the course provider, it can be called a central skills log, the nursing progress log, or the e-portfolio, among some others. And then once the student veterinary nurse feels that they're competent at this task, they perform it for the clinical coach, who will then sign them off if they agree that they're competent. And just to add, because they're competent, it doesn't mean that they're going to be able to go away and just do it and not ever need to ask for help. So competence is that you can do these tasks, you understand them, but by completing them over and over, you then become proficient in them. So So it doesn't mean that the competence is that, yeah, you can do it now, go off and you can do it on your own. You may still want some support before you become proficient, which will come when you've been registered and working for a few years. So a little bit about the VCAs. We'll cover it in a lot more detail later. They are not allowed to perform any of the Schedule 3 procedures, which we'll explain shortly. They support the whole of the veterinary team. They are not just glorified cleaners. Obviously, in a hospital environment, it is a very big part of the role of anybody who works in the environment to make sure that infection control is taken care of and that the place is clean and stocked. But it's not that that's not their role to just do that and nothing else. There's lots that they can do. They are not able to be registered with the Royal College of Veterinary Surgeons. And then we'll cover the whole role of what they can and can't do in a little bit more detail later. The veterinary students, they come to spend time in practice as part of their training. They're not registered with the RCVS until they qualify. However, to part of their clinical training, they are required to perform acts of veterinary surgery to gain the experience to be able to pass and become veterinary surgeons. So unregistered nursing staff. So this may be a veterinary nurse whose registration has lapsed and they haven't renewed it for some reason. Maybe a veterinary nurse from another country who's not able to register with the RCVS. However, they can only perform really the same roles as a VCA. They can't do any Schedule 3 procedures. And you may or may not be aware that BVNA have been running quite a big campaign because the title of veterinary nurse is not a protected title. So anybody can work at a vet and say, oh, I'm a veterinary nurse. So we've tried to raise this profile to really educate the public and understand what is a registered veterinary nurse and to try and get it through Parliament that it is a protected title and that only veterinary nurses who are qualified and registered with the RCVS are able to give themselves that title. In our client care and reception team, so this is a front of house role. These are the first people that clients see when they enter the building. A lot of administration to be done. They schedule appointments. They can dispense some medications. So there's different categories of medications, some which only vets can prescribe, which known as prescription only medicines. The category AVM, GSL, these are things like medicated shampoos and supplements and some worming treatments. So they are able to sell basically called over-the-counter medications. They complete insurance claims. If there are any complaints, these are the people who are usually the first person to receive the complaints, and then they receive payments. They can become British Veterinary Receptionist Association members, and then they can gain qualifications in the role and then become a BVRA associate. So there is a course that they can complete as well to help with their role. Work experience students, this should be an observing role only. Maybe some very basic cleaning tasks like spraying and wiping a table in between appointments. The youngest that should really be doing work experience are year 10 school students, so age 14 and 15 as part of their work experience week that they have to partake in. However, some practices decide that they should be over the age of 16 or 18, so just make sure that you're aware of what your practice rules are. Veterinary nurse or vet from another country, and they may have to do extra qualifications to be able to be eligible to register with the RCVS. However, until this has been done, they're classed the same as a VCA. They can only do the same tasks as a VCA can, which doesn't include Schedule 3 procedures. So I keep talking about Schedule 3 procedures. So what does this mean? So the Veterinary Surgeons Act 1966 is a piece of legislation which aims to ensure that all persons treating animals are qualified to do so. The Schedule 3 amendments, which was in 2002, permitted the delegation to RVNs and SVNs to perform some minor medical and surgical procedures not involving entry into a body cavity. So there's a little bit of a grey area. So in the last few years, the RCVS have produced a poster to try and help to understand what Schedule 3 is and when veterinary surgeons should be delegating tasks. So the writing's quite little, so hopefully you can see it. But they've used that acronym SUPERB to try and help to remember what exactly we should be considering when we're delegating tasks. So is the procedure a medical treatment or minor surgery not involving entry into a body cavity? So remember that certain things are off limits, including independent medical treatment or minor surgery, major surgery, diagnosis, certification, castration, spays, and dental extractions using instruments. So under care, is the animal under your care? Has the client given you responsibility for the animal's health? Have you seen the animal immediately before delegation or recently enough to have personal knowledge of its condition? Person, can you delegate to this person? Under Schedule 3, you can only delegate medical treatment and minor surgery which doesn't involve entry into a body cavity to RVNs and SVNs, not to lay people. Experience. Does the RVN or SVN feel capable and have sufficient competence and experience? Are they familiar with the species? If they've not done this procedure before, have they had the right training and will they be supervised? And if there is a problem, do they know what they should do? The risks. Have you considered the risks specific to this case? So how difficult is the procedure? How likely is it that something could go wrong? And does the RVN or SVN understand the associated risks? And then finally, be there. Are you available to direct or supervise as necessary? So RVNs must work under your direction, which means you've provided the necessary instructions about the task to be performed, but you don't have to be on the premises. And then SVNs must work under supervision. So it just helps to understand what these Schedule 3 tasks are a little bit. I hope that has helped. And then it's important that the whole team understand the role of the VCA. So say whenever I've been in hospitals or doctor's surgeries, they quite often have posters like this with different people's uniforms corresponding to what their role is to try and help, say, the clients and patients to understand the different roles of the hospital. So it's a really good idea to replicate this in veterinary practices as well. So could they have different colour uniforms to the nursing staff and the veterinary staff and the receptionists so that they stand out as their own as VCAs in their own right? And if everybody understands what their role entails, it will avoid any delegation of inappropriate tasks. So for instance, a new veterinary surgeon or a locum who's not familiar with the team structure may believe that a VCA is actually a nurse if they're wearing the same colour uniform, and may delegate something that is a Schedule 3 task. So it's important that the whole team understands Schedule 3 procedures. And remember that the VCA role is not taking the role of the RVN, but it's complementing it, and it really does help to build on that team culture of working together. And the overall aim is to promote animal welfare and well-being. So to make clients aware, we could have posters similar to the one on the left, waiting room displays to just explain the role. What does a vet do? What does a vet nurse do? What VCAs do, just to help educate them and give them something to look at whilst they're waiting for their appointments. So that's great, but what VCAs can do in practice. So they can work in all areas of the practice, so not limited to these ones, but they can do reception tasks, they can work in wards, they'll be involved in theatre practice and surgery, they can perform some consultations, they can work in the dispensary, they can be involved in anaesthesia, and diagnostic imaging, and they may have the opportunity to specialise in an area of interest. If they particularly like working in the wards and working with the inpatients, it may be possible that could be their area of interest, where they are able to work all of the time in bigger hospitals. So in reception, they can do all of the reception duties. They can book appointments, general client care, procedures and roles, can complete insurance claims. They can be involved in bereavement support. So people who've unfortunately had to have their pets put to sleep, or they've lost them due to an illness. They often do provide support, because it is quite a stressful time for them. So the VCAs can be quite involved in helping with bereavement support. They can complete financial transactions, and there are receptionists who completed the VCA course, so they've learned about all areas of the hospital, and it does actually enhance the reception role, because they understand how everything works in all areas of the practice as well. So working in wards, so they can calculate and monitor the RER for patients. So the RER is the resting energy requirement. So basically the calorie requirements of that patient. So we can calculate how many calories they should have in a day and work out a meal plan for them. Then at the end of the day, this should be assessed to make sure that they have received enough calories. If not, they can have another meal late at night, just to try and make sure that they receive their nutritional requirements. So TPR, this is measuring the patient's temperature, their pulse rate and their respiratory rate. So this is important. We do this at least twice a day for all inpatients. If they're more poorly, we often do it a lot more frequently. So this is something the VCA can do. The walking and grooming inpatients. So sometimes they have to wear Elizabethan collars and not able to keep themselves clean, particularly cats who like to groom themselves. It can help their demeanour if they are groomed by somebody whilst they're in the hospital. And hold patients for procedures. If they're having something done, for instance, a blood sample being taken, the VCA can hold them for that. So TLC, tender loving care, really important thing to do for patients. So they can quite often be a little bit stressed. They're away from home, they're not feeling very well. Just spending a little bit of time with them, giving them a fuss, can really help their demeanour, encourage them to eat. It's a hugely important role to fulfil. I think in processing diagnostic samples, so this might be blood tests that are run in-house, or some samples that are sent to external laboratories. Infection control and housekeeping. Obviously, I mentioned it's not just a cleaning role, but it is very important that the patients have got clean beds, infection control, the place is kept clean. So this is a part of the role, but obviously they can do lots of other things too. So oral and topical medication, so that's basically tablets or liquids that they have either in their food or straight into their mouth. And then topical medication, so creams and things that are applied direct to the skin. SC injections, this stands for subcutaneous injections, so basically an injection into the scruff of the neck. And then tube feeding, so some patients are not eating, they sometimes have a feeding tube placed and the food is fed directly through that tube. For consultations, they can be involved in admitting and discharging patients for routine procedures, so it might be routine neuterings, things like that, as long as a veterinary surgeon has seen them recently and given them a full examination, and it's just a matter of going over the admission information with the clients. Simple procedures such as nail clipping, weighing for flea and worm treatment, so especially young patients, so dogs who are going to, particularly big dogs who are going to weigh more each month, they often pop in and just will weigh them to make sure that they have the correct dose of flea and worm treatments. And supporting clients in euthanasia appointments, so this is like as I've already mentioned, a hugely important part of our role is to provide support to clients when they're upset and losing their pet. And then other certain things like external anal gland expression. But it's important that they know if anything is not straightforward and they've got any concerns whatsoever, that they refer the patient to an RVN or a vet if it's not an easy, straightforward procedure. Second dispensary, they become an SQP, which stands for a suitably qualified person. But this is a separate qualification that can be completed to enable them to prescribe certain products. So there's certain classifications of drugs. So they're not prescription-only medicines that only vets can prescribe. So a POM VPS can be prescribed by a vet, a pharmacist, or suitably qualified person. So this mostly is preventative treatments and flea and worm treatments and medicated shampoos and supplements. So the prescription medicines, things like antibiotics, blood pressure medications, pain relief, things like that, only veterinary surgeons can prescribe. Stock control is another big role in veterinary hospital, making sure that stock levels are correct, and that as new stock is brought in, it's rotated to make sure expiry dates correspond and things aren't going out of date and costing lots of money. They can dispense medications that have been prescribed by vets, but anybody who dispenses any medications should always get someone just to do a second signature, just to check there's not any mistakes. Anesthesia, they can prepare and maintain the anesthesia equipment. So anaesthetic machines should be leak tested before use, and different tubing and circuits that are used to attach the patient to the machine need to be checked before use as well. So ET tubes, these are the breathing tubes that go into the patient's throat and attaches to the circuit. So these have to have some maintenance too. They can perform this. They can set up and maintain the monitoring equipment. So IV trays, so we've got cannulas that are placed into the veins, same as in humans. They can monitor general anaesthesia under the direction of a veterinary surgeon and monitor the recovery of patients following anaesthesia. And also, again, grooming and hygiene and TLC whilst these patients are recovering is important too. Theatre practice, so working within the operating theatre. So setting up the theatre every day, we do what's known as damp dusting, so just make sure we clean everything and make sure any dust that settles removed before the first operation of the day. Instrument care, maintaining sterile supplies. Surgical site preparation, so the clipping of hair and the disinfecting of the skin. They can be the circulating assistant, so this is somebody who will be in the operating theatre with opening sterile equipment, just generally getting things and helping, passing suture materials and just anything that the surgeon needs. So they can, what we call the scrubbed assistant, so they can wear the operating gown and gloves and help with some sterile procedures, so ideally more basic ones, so holding external equipment, so such as lap cameras. So if they're having laparoscopic surgery where a camera is placed into the patient and everything's done almost like we see on the medical programs where we do robotic surgery, it's kind of similar to that. So the instruments, only part of them go into the animal, so they can help to hold these for the veterinary surgeon. And then closing down theatre at the end of the day, and again, infection control, very important part of the job. Diagnostic imaging, so X-ray, ultrasound, CT, all different types of imaging that we can do in practice. So they can set up this equipment. They can help an RVN to monitor the sedation and position the patients. And then they can restrain the patients for conscious procedures. So ultrasound scans are quite often done without any sedation. It's not a painful, stressful procedure. Obviously, some patients get a bit worried and need some sedation, but quite often they will tolerate it. We can just do it with them awake, and they can help to hold them for this procedure. So we've talked about what VCAs can do. However, there has to be reasoning behind what they can do. So we're going to look at what they should be doing. So to be doing these tasks, they should have had some training, and there should be a way of monitoring that they're competent in these tasks. So a training log can be made similar to that of what the student veterinary nurses complete. So they'll be shown a task, they'll be practicing it under supervision, and then once they're able to do it competently, they're allowed to perform it unsupervised. But obviously we're going to tailor this specifically to the VCA role, which is relevant to the practice that they work in. So depending on the practice or hospital, the role may vary slightly. So it can be tailored to what the practice requires of the VCA. A mentor can be provided. So ideal person to do this would be a registered veterinary nurse, or a veterinary surgeon could do it as well. And then there is a training course, which a VCA training course, which should be completed as well, which teaches the theory of all the tasks that they will be completing. So they'll be learning about anatomy and physiology, infection control, reception, trying to get a theory of why we do things in a certain way. So when is it appropriate for a VCA to perform these tasks that we've mentioned? The RCVS has a code of professional conduct, which anybody who's registered with them, so veterinary surgeons, RVNs and SVNs, must adhere to. And there's a section dedicated to treatment of animals by unqualified persons, and there are restrictions under the Veterinary Surgeons Act. So the VCA is classed as lay staff in the RCVS Code of Conduct. Delegation to lay staff must be justified to preserve animal welfare. And professional judgment on a case-by-case basis following risk assessments, and it should be reasonable in all of the circumstances, not put the animal at risk, and not amount to more than minor medical treatment, the sort which an owner could undertake. So, for example, the administration of uncomplicated oral medications or subcutaneous injections. It goes on to mention that the RCVS considers there are certain tasks that should not be delegated to unqualified members of staff. Examples include intramuscular or intravenous injections, so injections that go in straight into a muscle or directly into a vein, and invasive procedures such as the introduction of an IV catheter or the passage of a urinary catheter. Veterinary surgeons should generally ensure that the client is made aware of any procedure to be performed by practice staff who are not veterinary surgeons where appropriate. It also goes on to say the directing veterinary surgeon remains responsible for their decision to delegate to an unqualified member of staff. Should a delegation decision become the subject of a professional conduct investigation, the RCVS would consider the reasonableness of the veterinary surgeon's decision. A clearly reasoned and recorded decision should therefore be behind every delegation to an unqualified member of staff. So if we look at what we've been through just about what they can do, we're now looking at what they should do. I've made a few notes. So the temperature, pulse and respiration measurements, they absolutely can do that, but it is important that they know what is normal for that species and when to report anything that's abnormal. So it shouldn't just be a box ticking exercise and they do it, they write the numbers down and move on to the next patient. They need to know when this is abnormal and when to notify an RVN or a veterinary surgeon. So the infection control and housekeeping, I've mentioned a few times, it's important that they understand how essential this is to their role. So everybody in the practice has a role to play in infection control, but it's not just a quick sweeping of dust at the end of the day. It is a very important role to prevent infections and spread of disease. So oral and topical medications, as long as they've been trained and are deemed competent and understand any likely side effects and precautions. So some drugs you have to handle with gloves or wear various PPE. And then also what the likely side effects of that drug to the patient may be. So subcutaneous injections and tube feeding, owners can do this at home, so their patients and their pets can be discharged with a feeding tube, or for example, a diabetic cat or dog will need to have daily, sometimes twice daily injections. At home, the owner is the most qualified person to do this, whereas in practice there are more qualified staff available. So the vet must consider, is it appropriate to delegate these tasks to a VCA, who the RCVS considers as someone who is lay staff, if there are more qualified staff available. So, and some practices do this, and it's fine as long as the consideration has been given about whether this is appropriate or not. So consultations. So ideally this should be RVN or SVN. However, if these are busy and the VCA has received appropriate training and been deemed competent, then it's okay for them to perform these consultations. However, owners should know who is going to be performing the consultation, so they may be believing that they're seeing a registered veterinary nurse. If that is not the case, when they book in the appointment, it should be explained this is going to be with our veterinary care assistant Emma, who's going to be doing that. Is that okay? And just make sure that they understand the difference in the role. Most owners will probably be absolutely fine with it, but some will be like, oh no, I want to see a veterinary nurse, and that should be respected. So dispensary tasks, I went over. So they must be supervised until they've received the appropriate training. And then all medications which are dispensed should always be double checked before sale, which I think in most practices is the procedure anyway, that anything that is dispensed, you should have a second signature just so that somebody else has double checked it, just so there's no human error that has occurred. Anaesthesia. So monitor general anaesthesia under the direction of a veterinary surgeon. So the RCVS Code of Conduct says that if there's no RVN or competent SVN available in exceptional circumstances, that a VCA or layperson can monitor the general anaesthesia, but the veterinary surgeon is the person who directs them. So they, it is the veterinary surgeon's responsibility. And RCVS also say the ideal people to do in this role is an RVN or SVN. So monitoring the recovery stage of anaesthesia, it is still very much part of the anaesthesia process. There was a large study performed several years ago now, which found that most anaesthetic deaths occur on the recovery period. So really, these patients still need close monitoring whilst they're in their kennels recovering. Our CVS Code of Conduct says that evidence of suitable training must be provided when lay staff VCAs are monitoring anaesthesia. However, BVNA believe it's not appropriate at any point for a VCA or any member of lay staff to monitor anaesthesia. Grooming, hygiene, TLC, anybody can do that. It's really important to help with demeanour and help the recovery of patients. Now looking back at theatre practice, they can do all of these roles as long as they're fully trained, they've been signed off as competent, and they understand the importance of all the roles and the infection control. Diagnostic imaging. So they're not trained in radiography, so shouldn't be involved in setting the KV, MAS, the settings of the x-rays. This is still, there's lots of legislation, safety involved, so it should be somebody who's fully trained in radiography, who's putting the settings into the x-ray machine. However, if they're helping a veterinary nurse or a vet take images, there are times when the vet or nurse needs to stay in the room. So if we need to take a chest x-ray, when people, you can just say, breathe in, hold your breath, obviously we can't do that with our patients. They will be anaesthetised and we have to inflate their chest with the anaesthetic circuits. It would be okay for the VCA to take that image whilst the vet nurse or vet or student vet nurse is doing that inflation, as long as they're aware of the radiography local rules and also the emergency shutdown procedure. So if for some reason the machine malfunctioned and didn't work properly, you can just hit an emergency button which just shuts down the whole machine. So it's important they understand what to do in an emergency if that did happen, and then they need to be considered competent to do this under delegation. Now, who can be a VCA? It can be the first step up the ladder to becoming an RVN. It can help to increase the chance of finding a placement if you've already got a job in a practice as a VCA. Also, it looks really good on a CV if you want to look elsewhere to try and find a placement to train as an SVN. Receptionists can complete the VCA course. It doesn't have to be leading to another role. It could be somebody, you might just want to be a VCA, you might not want to do the veterinary nursing course. I work with several VCAs. One of them spent most of her career as a police officer and they decided she didn't want to do that anymore. She wanted to do something different and is now training to be a VCA, and she's done a wonderful job. So, like I say, career changes from a different profession. It can also help if you want to be an RVN, but you don't have the qualifications to get onto the course. So you need to have 5 GCSEs at grade A star to C, or the new grading system 4 to 9. If you don't have those qualifications and you complete the VCA course, it may be enough for you to then go on to complete the SVN course. So how do you become a VCA? It's a level 2 course. Oh, sorry, my dog decided to bark. It can be completed as an apprenticeship. If it is the apprenticeship route, it's possible that it'd be funded by the government if you're eligible for that. Sometimes practices will pay for the course if you're not eligible for government funding, or you may self-fund it, and some colleges do offer payment plans to make that a little bit easier. It's offered by colleges UK-wide. It can either be in person or online, or a combination of both. One really important thing to note, something I've become aware of since working at a veterinary nursing college, we have people phone up and say, oh, I really want to become a veterinary nurse. I've done this animal management course online, but it hasn't been Ofqual registered, Ofqual accredited, sorry, which stands for the Office of Qualifications and Examinations Regulations, which means it doesn't count as an official VCA course. So people can spend their time and money completing these courses, but because they're not accredited, it doesn't actually count for anything. So just make sure any courses that you enroll on, if you want it to lead into becoming a VCA or an SVN, that they are Ofqual accredited. You look for a placement by sending your CV and a covering letter to all local practices within your commute. Quite a long time ago, so that's probably about 15-16 years ago, I literally got the yellow pages out and phoned every practice that was within a commuting distance for me and got another job that way. Obviously times have changed, the yellow pages even exist anymore, but you can still Google practices within a certain area and just send your CV and covering letter to them. If there's not a place available currently, often this will be kept on file, and then if a position does come up, then you may be contacted. And then ask practices if you can do some work experience, be able to build a rapport. If they get along with them, they get to know you, they see that you've got a passion for this role, you may be able to find a placement in that way too. So how can your career progress from being a VCA? So as we mentioned, it can lead to a student veterinary nurse placement. You may find an area that you really enjoy and be able to specialise in it. So you may find a niche. You might really enjoy ward nursing, so choose to work in just the wards. You could become the lead of a team of VCAs or lead a team of VCAs in a specific area. So if there's a group of ward VCAs, you could be the lead VCA for them, or theatre, imaging, any area. But just say not all VCAs want to progress to be vet nurses. Many VCAs love that role and just want to continue doing that. So how can BVA support VCAs in their career journey? So we have lots of in-person and online events, which members receive discounts on tickets. CPD, which stands for Continued Professional Development. This is something that RVNs and veterinary surgeons have to complete. So RVNs have to do a minimum of 15 hours continued professional development a year, just to make sure that their skills are up to date and learning sort of new advances and things all the time. Or if you want to specialise, if you particularly like anaesthesia, it can be lots of courses in anaesthesia. There's no requirement for VCAs to complete CPD, but many just do it for their own personal development. The BVNA members have access to hundreds of hours of free CPD. It's recorded lectures, webinars and podcasts on the website. The BVNA members have free access to the members advisory service, and this is really useful. It gives confidential advice regarding employment law, legal issues, redundancy, disciplinaries, grievances, contracts, matrimonial and financial matters. You'll receive the Veterinary Nursing Journal, which is a bi-monthly journal, which is available online or printed, and all members get that. And it's full of peer-reviewed articles, some, say, from the members' advisory service, advice on topics such as maternity pay, things like that. And it's really, really useful for learning all kinds of things. So there's lots of online training courses. There's a learning pathway in behaviour which VCAs can complete. And then there's a discounted rate for members for all these courses as well. I have lots of toolkits. So these are full of podcasts, webinars, advice and support on a variety of different topics. So I've got several of these, including advice, help for people with chronic illnesses and navigating these in the workplace. Welfare of pets in schools, which is aimed at teachers to help them, if they have pets in schools, to be able to do it in the most promoting their welfare and try and encourage them in other ways of educating children other than getting a pet and keeping it in the classroom. There's a student toolkit, which helps with all different sort of obstacles of being a student, and there are more toolkits that are on the way that are in development at the moment. Every year we have a congress. It's an annual exhibition and CPD event. It's for 3 days in Telford. VCAs can attend all of the lectures. On Friday night we have a quiz night, and on Saturday night there's a dinner, dance and awards evening. Then we are thinking about whether to have a VCA stream, so to focus on lectures that would be specific to the VCA role. So if any of you do attend Congress as VCAs, or just anybody wants to give any feedback on whether they think that would be a good idea, they would be really keen to hear from you. VCA to join BVNA, would join it as an associate member, which costs just £3.66 a month or £44 a year. And then if you do choose to progress to an SVN, all these benefits are available to students as well. So we've had a look at the practice structure and dynamics, what VCAs can do in practice, and also what they should be doing in practice in relation to our CVS Code of Professional Conduct, opportunities for career progression, and how BVNA can support VCAs in their career journey. May have heard this little guy. I thought you might do, so I thought I'd put his picture on. He was barking at the door a minute ago, so I'm sorry about that. But has anybody got any questions for me? And thank you very much for bearing with me.
Thank you so much, Emma. It was such a comprehensive run through of such a vast role. I think it's VCAs are such a heartbeat of veterinary practice, and it's really easy sometimes to forget how much they absolutely can do. So it's so lovely. The chat has been really busy. I've been struggling to keep up because there's so many VCAs who really want to do more and are empowered to do more. So we've had lots of questions come through. So if I can fire a few at you, that would be amazing. And then just in case we don't quite cover your questions, I've private messaged lots of you already, but there's so many questions that I think it would be great if we could expand some of them and maybe create a blog specifically for our VCAs, because there's obviously the want there. So it'd be really nice to expand on that. And I think,
yeah, that's a brilliant idea.
Seeing more VCAs encouraged is brilliant. So are you ready?
Yeah.
So SQP training has come up a lot. Lots of people are asking, if you can be an SQP without doing the VCA qualification, and if they were looking for information on it, where would you suggest they go first?
Okay, so this is provided by Lantra. Is it Lantra? I might have to double check. I don't think it is. Is it? Blank then. So if you are an RVN, you don't have to do so much of the course to become an SQP, but anybody can do this course. So people who work in pet shops or sort of saddleries who sell worming treatment over the counter complete this course. So you don't have to be a VCA. There's different categories, so you can do it for one species or farm species, or all different species. So if you go onto their website, then there's loads of information on there. So yeah, it's something that definitely can enhance the role of a VCA, but you don't have to do either or both of them to get to either role, really.
Amazing, thank you. I know you have touched on it, but it's something that lots of people were asking in the chat, so I just want to reiterate it for anyone that didn't catch it, because I know lots of people were looking at several of the links as well, which is great. Can VCAs carry out anaesthesia? And there's a second part to that. Not only can they carry out anaesthesia, can VCAs recover patients from anaesthesia?
So it is, I believe that RVNs and SVNs should be like monitoring and recovering anaesthesia. The RCVS Code of Conduct has just highlighted that the person doing it, if they are VCA or lay staff, must have been trained and their delegation must be justified. So it depends on the practice and the dynamics and how well trained they are. I personally believe there's so much to learn about anaesthesia. I'm teaching it at the moment and I'm literally starting it, and it's going all the way through to Christmas. So there's so much to know, and they don't know the physiology and how drugs affect things. So I think, and as a lot of complications occur in the recovery, it's still a very important part of it. So maybe once the breathing tube's been removed and the patient's sitting up and able to protect their own airway, that might be a good time that they then take over the recovery stage instead of when the patient's not quite ready to be left. But I think it has to be a consideration for the individual practices whether they feel it's justified or not. But really, it should be somebody who is trained in anaesthesia who's monitoring them. Ultimately, it's the veterinary surgeon who makes any decisions about it, but if there's somebody available who is trained in anaesthesia, but a VCA is monitoring the patient and there was a complication, it'd be quite hard to justify if there was like a professional conduct investigation that why the qualified person wasn't there if they were available that day. So there's quite a lot of considerations, really.
Exactly. And on the flip of that, there are then nurses who, like RVNs or SVNs, who have recovered patients who, when that patient is appropriately recovered, can be handed to a well-trained VCA to then go on with the treatment, because they're going to be the continuity through the day with that patient, so they can absolutely be utilised. It's just using your right person at the right time to free up as many people as possible. It's all about the team, isn't it?
Yeah, right at the beginning, we're trying to have a team culture and all these different roles work as one to just make sure that the patients are okay. Basically, that's the goal of being in a veterinary practice, is the animal welfare. So
I love that. I love that. And then is that animal management level 3 qualification the same as a VCA? I know we touched on this right at the beginning, but just to recap, because I know lots of the terms are interchangeable.
They are, yeah. Won't lie, I'm not 100% sure, but I can look into that. I think obviously, so many different colleges that offer these courses. There's going to be some variations, but I can look into that, and then if we do produce a blog with all the answers to all the questions, we can add it to that and sort of answer that one there. I'm sorry.
No, I think that's a great idea, because there are so many, and there's so many different routes of which you can do it. So maybe we can add that to a blog or a flow chart, depending on the feedback we get. Like I say, the chat has been busy.
Well, I did research and have a look at different colleges that offer the courses, and there's so many, and I think there probably is different variations to which course can be completed to get the qualification. But yeah, definitely we could look into that a bit more and add that into the blog.
Amazing. And then last one before we wrap up, and then what I'm going to do is pick out all the ones we've not answered to add to our blog. And just another urge, there's so many here that if you do have feedback for us, please do email us, so that we can look at maybe adding more, as Emma mentioned, to Congress, because there's clearly a want for it from VCAs, which is phenomenal. So lastly, there doesn't seem to be anything on extubation or doing bandages, and they're two very different things. Are VCAs allowed to do these things?
Saying allowed is again deciding the delegation, is it appropriate? Personally, I think extubation, it's still quite early in the recovery process, so I think really that should be left to an RVN, or if not an RVN or an SVN available, a veterinary surgeon. I think there can be lots of complications that occur either during that process or immediately afterwards, so I do feel that is more of a qualified person's role. Bandaging, again, this is something that an owner can do at home. So the RCVS Code of Conduct says that lay staff, which incorporates the VCA, can perform tasks that are done by owners at home. So with the correct training and supervision, say having some sort of training log that they can show they're competent, and perhaps get someone just to check the bandage once it's been applied, then I don't see any reason why that can't be done. Yeah.
Thank you. And it is, it's a really good point. It's all about that training, and there's lots of things that animal advocates and caregivers are doing at home, and it's just, we need to remember that quite often they are given guidance to be able to do that at home, whether it be injections or anything. So we need to make sure that we are supporting our VCAs to utilise them more, which has come across loud and clear this evening. There's such a wealth of things that can be utilised for, and I want to do that. And I think it's really important that we support our VCAs to also support us as registered veterinary nurses. It's all about working in symbiosis, isn't it?
Oh yeah, definitely.
Thank you so much. Thank you to everyone who's joined us this evening. Thank you so much, Emma, for such a comprehensive run through of the veterinary care assistant role. We will be sending out the recording. There's been lots of calls for it and lots of people asking to show their practices, which is brilliant. So that will be coming out over the next few days for you. As Emma said, VCAs are absolutely welcome as BVNA members. And you have a specific membership as an associate membership that you can utilise. You can pay monthly or yearly. You are more than welcome at our Congress. We love to have a dance and a quiz, as Emma said, and you would be welcome at all aspects of Congress. As a VCA, SVN, RVN, everyone is welcome, and we can all learn how we can support our profession and our patients better together. So thank you for this evening, and we hope you found it helpful. We look forward to receiving your emails and calls for more support, and if there is the want for it, we will very much be providing it. Have a good evening, everybody, and I hope the week is kind to you.
Yeah, everyone.